Good afternoon. Welcome to an exciting and important conversation. My name is Delegate Stephanie Smith. I'm the chair of the Baltimore City Delegation to the Maryland House of Delegates, and I am joined by my colleague, and I'll allow him to introduce himself.
Thank you, Chair Smith, and good afternoon, everyone. I am Delegate Eric Barron, Chair of the Prince George's County House Delegation.
Thank you. And today we have joined forces as jurisdictions with our executive leadership, our public health leadership, and our community leadership to address an issue that I know is on a lot of people's minds, vaccine inequity. So I just wanted to share a bit of what I've been dealing with because I believe it's similar to what many of our constituents and neighbors have been dealing with. We already knew from the beginning of this pandemic that a vaccine was going to be the key to recovery. But a vaccine has to become a vaccination in order to save lives. And for many weeks, I've personally been grappling with the inability of securing a vaccination for my 69-year-old mother who has heart disease. She is tech savvy, so she knows how to get on a list and do what she needs to do, but we were still meeting many dead ends. So after venting on Twitter, I connected with a volunteer who said they wanted to assist me in the hunt for a vaccination. Thankfully, through these volunteer efforts, I was able to make an appointment, but it's disturbing that that's what it took. Maryland is home to world-class public health institutions, a vibrant network of civic organizations, robust higher education institutions, and an array of professionals committed to equitable public policy outcomes. Despite this bevy of resources, our constituents have to rely upon Facebook groups and personal networks to receive something that should be coherently managed and executed by the executive leadership of our great state. Today's hearing is not about merely assessing the scope of our current deficits, but about harnessing the creativity, the expertise, and commitment of a variety of local government, public health, community, faith, and civic partners to compel our state to develop a publicly accessible vaccine equity plan. A state vaccine equity plan must be developed with the communities most at risk. Our delegations are here to find solutions and to inform the state's efforts to move from equity rhetoric to equity action.
Thank you, Chair Smith. So I've had some of the same issues with respect to my own parents and getting them the vaccine. And this despite a long documented history of healthcare and other disparities among Black and brown communities. The state still fails to take this into account into its planning. Now, once again, this is costing us our lives, literally. As a community, we're simply not getting vaccinated. Prince George's County and Baltimore City are the most vulnerable and hardest hit in the state, and it's no surprise why. This all should have been well anticipated. Our population has the most underlying health issues that make us more at risk. Our population has an outsized share of essential workers, making them all the more vulnerable from the virus. Our population has a relative lack of access to health care, again, making us more at risk. None of this information is new. So why wouldn't the state take this into account in the allocation of vaccines? Our population has a relative lack of transportation options. Our population has the most senior citizens eligible for vaccination at phase 1. Our population has the most low-income senior citizens of color. Our population is more likely not to have access to the internet or a mobile device. Again, none of this information is new. So why is the state not taking this into account in its planning? One reason is that the plan apparently did not include these equity considerations to begin with. Another reason is that the approach and the process has not been inclusive. Embracing instead of shunning diversity and inclusion will help us solve complex problems. It'll help us solve this problem. So I'm glad to be joined by the city delegation and my colleague, Chair Stephanie Smith. I echo your sentiments that our delegations are here to find solutions and inform the state's efforts to move to equity action. Thank you.
Thank you so much, Chair Barron. Without further delay, I think it's appropriate for us to begin with the quarterbacks of our respective jurisdictions. So we'll begin with my mayor, Mayor Brandon Scott of Baltimore City.
Thank you. Thank you, Delegate, and thank you, Delegate Barron. I want to thank both of the delegations for having me here today on this important and timely issue. And let me start out by saying this very simply. Despite statements otherwise, the residents of Baltimore City are both entitled to and deserve the vaccine. However, our residents do not have equitable access to vaccine doses, and the state is not providing an equitable share across local jurisdictions. If vaccine distribution were equitable, we would expect to see comparable rates of vaccination across racial groups and jurisdictions, but vaccination rates are not tracking with the size or racial demographic of county populations. Data indicates that despite enormous demand for the vaccine, I had a telephone town hall last night with over 1,000 seniors, older adults here in Baltimore City. That demand far exceeds the supply. There is tremendous variation of the percentage of the population vaccinated by county. To date, 73,000 Baltimore City residents have received a first dose, representing just over 12% of the population. And as of March the 2nd, 2021, 38% of individuals that received their first dose in Baltimore City were city residents. Though Black residents account for 60% of the city's population, only 6.7% of our Black residents have been vaccinated, while 17% of our white residents have been vaccinated. Data also indicates that Baltimore neighborhoods with low vaccine coverage are predominantly African American. In comparison, however, more than 18% of Garrett County's population and 21% of Talbot and Worcester populations have been vaccinated. Fundamentally, the state has ignored the barriers to access for communities too often left behind when we talk about healthcare, not just in the state, but in our country. For instance, the state's online-only sign-up model, known as PrEP mod, has forced local governments, including us, to develop workarounds. Additionally, the system is inaccessible to too many of our vulnerable residents, including older adults and families that have no access to the internet due to the digital divide, which we know is real. The lack of a centralized vaccine appointment system has made for a confusing process across Marylanders, where people here in Baltimore are being sent to Six Flags in Prince George's County, and people in Prince George's County are being sent here to M&T Bank. That should not happen if we have the appropriate system for this rollout. As a result of the state's shortfalls, we've been working tirelessly to try to address these barriers and resulting disparities. I've asked the state to reserve slots at the mass vaccination sites in the city on a daily basis for the 19,000 older adults age 65 plus who have called our call center or filled out our interest form for existing and then in scheduling through the state's online system. Teachers at our schools, judges and staff from our courts, and eligible Baltimore residents in phase 1A, 1B, and 1C who face challenges obtaining first dose appointments. To share data, we launched a dashboard that gives residents a transparent look into the city's vaccination efforts in real time. That dashboard shines a light on our allocations, including where they're going, who they're going to, and the percentage of residents who are receiving the doses versus those outside of the jurisdiction. Our health department is doing great work working with healthcare partners to provide mobile vaccine clinics to support the vaccination of older adults, individuals at homeless shelters, and individuals in congregate living facilities. This is just a general overview of the issues we're facing as a city. You'll hear more from our health commissioner, Dr. Dzirasa, and our city council president, Nick Mosby. But while I appreciate the governor's support in standing up mass vaccination sites in Baltimore, more must be done, and we can't do it alone. We need more vaccine, we need more resources, and we need to capitalize on the mobile vaccination clinics and other targeted alternatives the city has established that have been more effective and receive more acceptance from our residents and communities of color. True partnership between state and local officials can lead to more equitable distribution of this life-saving vaccine, and we are doing our part to make that happen. Thank you both.
Mr. Chair, I just wanted, as a point of just recognition, Madam Speaker Adrienne Jones has joined us. She does not have time to speak, but I just want to make sure before we hear from the county executive, we do acknowledge that Madam Speaker Adrienne Jones is with us today. So thank you so much, Mr. Chair.
Thank you. I think next on the agenda, we have Georges County Executive Angela Alsobrooks. Well,
Thank you. Thank you so much. First of all, good afternoon to our chair, Stephanie Smith, and chair, Eric Barron. I do want to thank you so much for this meeting this afternoon. This is just amazing. I can't tell you how excited I am to have joined forces with you in this way. So thank you for convening. I'd also like to salute the Speaker of the House, Adrienne Jones, and thank her for her leadership and for the tireless work that she has done to ensure that all of us are well represented and that we make it through this pandemic safely. And to everyone else on the Zoom call today, all the other illustrious leaders who have joined us, I do also want to personally thank you for your leadership during this trying time. And thank you also for joining today to ensure that there is equity across our state with respect to these vaccines. I'm joined today by our County Council Chair, Calvin Hawkins, who needs no introduction and you will hear from shortly. Also joined by our Deputy Chief Administrative Officer for Health and Human Services, Dr. George Askew, who you will also hear from. And I want to say that while we are appreciative of the increased allocation of vaccinations that we have received from the state, we have gone from receiving a mere 975 of those vaccines per week. We have now seen those numbers rise to first 4,200, and now we are at 4,400 vaccines per week that we are guaranteed to receive, that we are deeply concerned still about the numbers. We are, for example, the mass vaccination site at Six Flags. To date, we now have numbers that tell us that of the approximately 32,000 vaccinations that have been administered at the Six Flags site, an alarming 3,500 of those have gone to Prince Georgians. In other words, only 10% of the vaccinations that have been administered at that particular site have gone to Prince George's County residents, which I don't have to remind everyone has the highest number of positive COVID-19 cases and the second highest number of deaths in the state. And so 90% of the vaccinations at that site have gone to residents from outside of our county. And I almost feel that I can make a full stop right there. I could use words to characterize what that feels like to us, that it is unfair, that it is outrageous, but I think the numbers speak for themselves. 90% of the vaccinations at a vaccination site in our county have gone to residents who do not reside there. Prince George's was hit especially hard by the pandemic because of the existing healthcare disparities in Black and Brown communities that have directly contributed to the high rates of health issues such as diabetes, hypertension, obesity, and other factors that made our communities more susceptible to this virus. We currently have 118,000 people who are pre-registered in our county on a waiting list, waiting to be vaccinated. So that flies in the face of what we have heard about the fact that Black and Brown people, I even heard it characterized as we refused to receive the vaccine. Now, both things are true. There are some in our communities who are hesitant and reluctant with good reason. The history tells us that those reasons are justified, but we have 118,000 people in our county who are on a waiting list who would like to be vaccinated. Approximately 67,000 of those are eligible and are in phases 1A, 1B, and 1C. Our health department has the capacity to provide as many as 2,000 vaccinations per day with just the health department sites, and we can do many thousands more when we combine with our partners who are assisting us, our healthcare partners from Luminous, MedStar, we have a number of partners who will allow us to ramp up very quickly. So we have the capacity to do thousands per day. With that in mind, and while we also believe that the state vaccination site in our county should place an emphasis on vaccinating Prince Georgians, I do want to thank the House and Senate delegation leadership for assisting us in making a formal ask of the state to do the following. In addition to the dedicated appointments that have already been set aside for Prince Georgians at Six Flags, we would like to see dedicated days set aside that would be used only to vaccinate Prince Georgians. We are also requesting that the state provide support and staffing to open up a vaccination site at the University of Maryland College Park and the First Baptist Church of Glenarden, which happens to be the largest church in Maryland. The University of Maryland College Park is located in a unique position because it is between two zip codes, 20783 and 20737, with some of the highest amounts of positive COVID-19 cases in our county. Both areas are also multicultural and heavily populated areas. Additionally, 20783 has some of the highest percentages of families and people living below the poverty line in our county at 13.1%. And residents in the area have also experienced the third highest case rate for COVID-19 in our county. The 20783 zip code is also has the highest percentage of households without a vehicle in the county at 18.2%, making proximity to a vaccination location a critical need. The 20737 zip code also has a high rate of poverty at 9.7 and leads the county in COVID-19 case rates. And so these two zip codes alone have an estimated 67,000 residents, which is a larger population than many of our Maryland counties. And so a COVID vaccination clinic located at Maryland College Park would support vaccine deployment to the hardest hit area in Prince George's. And we believe that if the state is able to honor these requests, it would go a long way in helping to ensure that our county and state are able to continue recovering from the pandemic. Our residents have been heavily impacted by COVID-19, but we know through all of our efforts that the coronavirus will not have the final say. And we will continue to recover. We will be better and stronger than before. And our residents, let me just say one thing really as I close, and I think this is the most important point of all. None of us are convened today to beg anybody for anything. Every single one of these vaccines belong to our residents because our tax dollars have paid for them. So we haven't shown up today to beg anybody for anything. We're asking for what we have already paid for. And so when we talk about whatever allotment we need, we don't want anybody to siphon that out to us. We want to be given only what we deserve. Our residents deserve these vaccines, every person, whether they are reluctant, afraid, or not. And as we now know, many thousands want these vaccines. They are desperate to have this life-saving resource. And the point of the matter is we are come together today to raise our voices and say we want every single vaccine that belongs to us. Again, our tax dollars have paid for it. And we'd like to just ensure that equity is achieved, that fairness is achieved, and that we are able to heal our residents like everyone else, and that this fairness is achieved as we do it. So thank you all so much again to our chairs and our other illustrious leaders for convening today. I so appreciate this meeting and look forward to us getting a great result. Thank you so much.
Thank you so much, County Executive. You know what? These are challenging times, but I feel, just really excited to have Mayor Scott and yourself up here being champions for our jurisdictions. We're very blessed and fortunate to have people in the fight who are doing the right things by us. So I'm just really grateful to hear both of you speak, but we know that we depend on our science friends, our health officials to really help us navigate all of these challenges. So we'll begin with the Baltimore City Health Commissioner, Dr. Letitia Dzirasa.
Thank you, Chair. I do want to just, again, thank you for the invitation. I'm really grateful for this opportunity to discuss some of the challenges facing Baltimore City as we support equitable distribution as well as administration of the COVID-19 vaccines. So throughout the pandemic, we have worked tirelessly to address the many inequities facing our residents. And I appreciate the chance to share where additional state support and transparency is needed. So as a background, the city is employing a multi-tiered approach to vaccine administration. This includes a mass vaccination site at Baltimore City Community College. It includes neighborhood-based support at our federally qualified health centers and our pharmacy, And it includes a focused mobile vaccination approach that brings vaccines directly to the communities that have been hardest hit. Our current focus for those mobile vaccination sites are senior housing sites, as well as congregate settings supporting residents experiencing homelessness. Additionally, we're reallocating doses to our clinical partners for distribution to older adults, as well as the mobile vaccination program. We established a central call registry back in January for older adults over the age of 65 who might be challenged to navigate the internet to register for an appointment. To date, as Mayor Scott mentioned, we've collected close to 20,000 names. Close to 20,000 residents in Baltimore City have indicated, older residents over the age of 65 have indicated an interest in getting the vaccine. To date, we have attempted outreach either for our vaccination site or through a clinical partner for almost 50% of those individuals. Much of this work, again, has been done in partnership with other healthcare entities. This includes our hospitals, schools of nursing, our pharmacies, and our federally qualified health centers. While this collaboration with clinical partners has been key to mounting a response, the lack of communication and coordination from the state has been frustrating, to say the least. We recognize that there are limitations in this current resource. It is very scarce. We're just asking that this limited resource be intentionally directed towards those that are highest risk. This intentionality can only happen in partnership and collaboration. I do want to thank the University of Maryland Medical System for their work. Their announcement earlier this week to focus on vaccinations of residents in the 6 most impacted zip codes with low vaccination coverage is a step in the right direction. And I'm very appreciative for their support and their commitment to our residents. However, we still need that state to provide some visibility into how vaccines are being distributed across all sites. So how many, as Mayor Scott highlighted, only about 30%, 38% of the vaccines given here in the city are actually going to city residents. But we need visibility regularly into what is actually getting to city residents from those state sites, as well as our hospital partners. We're fortunate in the city to have 11 hospitals, but again, our hospitals are responsible for vaccinating their staff and their patients. We want to make sure that our residents, because we know they want the vaccine, as Mayor Scott mentioned, that they are getting their fair share, and especially those residents that have been most impacted by COVID-19 are able to get the vaccine in a timely manner. As a local government, we're best positioned to support those high-risk residents to get that vaccine. We just want the opportunity to be able to do that. Thank you.
Thank you so much, Commissioner, for all that you're doing under all these circumstances. Next, we have Prince George's County Deputy County Administrative Officer, Dr. George Askew, who is kind of overseeing our health and human services in the county and is well-versed on what we're up to and what our needs are as a county. Thank you, Dr. Askew.
Thank you, Delegate Barron. It's wonderful to be here tonight. Great to see so many familiar faces, and also some who have not had the pleasure to be on Zoom or Teams or WebEx or whatever the particular platform we happen to be using from on any given day at any given time. I'm going to keep my remarks short and ensure what I'm saying is preaching to the choir in some respects. Our concerns are plain and simple about vaccine distribution efforts are all about the difference between equality and equity. And it's kind of, in a sense, a message to the state and a lesson to the state when we say, simply stated, equality is about giving everyone equal shares based on a formula that doesn't take into account where each person, group, or community stands at the beginning of the distribution of this resource due to other social, economic, and health issues. With equality, you don't achieve the same opportunity for success across the board. What you do is perpetuate a system by which those who are at the top at the beginning, those in the middle, and those below the middle will continue to occupy those positions as long as you use a formula that doesn't take into account other key factors to distribute a scarce resource. And in this case, that scarce resource is COVID-19 vaccine. Now, equity, as we all know, on the other hand, gives each person, group, or community what they need to achieve success. This may mean that some person, group, or community may receive more than others based on what a simple formula might have called for. Now, the state has used a population-based formula to dole out vaccine. This does not take into account, as many of you have already mentioned, the disproportionate impact of the COVID pandemic on a place like Prince George's. We have had the most cases and the second most number of deaths in the state. In addition, were you to account for, as we think you should, the disproportionate impact and the institutional and structural racism that has been historically experienced by communities of color, and the current health, economic, and social challenges faced by Black and Brown communities, such as those found in Prince George's County, you would have to see plainly that the amount of vaccine reaching Prince George's County is woefully, woefully inadequate. This includes vaccines being distributed to our hospital partners who have the infrastructure to deliver vaccines on an even large, on a large scale along with us. So, we call upon the state leadership to review their system of distribution to ensure that all factors are accounted for in making decisions about what gets allocated to each county. We also ask that officials not hide behind the veil of vaccine hesitancy to disparage a community that is eager and anxious to receive the vaccine. As the pre-registered number of nearly 120,000 currently on the waiting list, as the county executive has said, would clearly indicate. All told, we've had as many as 155,000 people on our pre-registration list who are waiting to get vaccination. Yes, clearly there are other stumbling blocks like the digital divide, transportation, need to work for essential workers that are key. But none of that matters if we don't have the vaccine in our hands, ready to give to folks when they show up, when they're ready to receive it. And as we know, 120,000 people are waiting right now to receive the vaccine in Prince George's County. Thank you.
Thank you so much to our health officials. We're praying for you and we're thankful for your leadership, and we're hoping we can get the state resources to fill the gaps that you've identified. Next, we're going to hear from our county and city leadership at the council level, because many times our residents are reaching out to their council members for assistance navigating this challenging landscape. We'll begin with the president of the Baltimore City Council, Nick Mosby.
Thank you, Madam Chair, and thank you, Mr. Chair, for convening us today. We're at a critical time. This is a critical moment, and it's critically important that we have leadership, and that's exactly what you called us here to do. What we know is that when government makes decisions in the dark, when they develop solutions, particularly in the midst of a crisis, without data, it's the underserved communities. It's communities that look like parts of Prince George's County or Baltimore City that are left holding the short end of the stick. There are communities that are already dealing with environmental justice issues, communities that are already dealing with health disparities issues, the communities that are dealing with transportation equity issues. And when you conflate the global pandemic on top of those situations, you exacerbate the situations associated with. We understand that. What we know is at this point is that data is king. And many of you in the Maryland General Assembly stood side by side with me as we fought the governor and fought the administration to start releasing something as simple as racial, ethnicity, and zip code data associated about how this infectious disease was impacting Marylanders. And it wasn't an easy ask. It wasn't an easy fight, but eventually we won when the media took the issue by storm. But we knew that it was really important, because what we knew at that particular time is if we did not call attention to the data, escaping the emotion of what we felt like and understanding and knowing how health disparities have always been at the root of issues of our community because of the way that the healthcare system has treated our community. What we knew is that if we put those emotions to the side and we provided our governor, we provided our health department, we provided our residents with the actual data, it would be scary as it relates to our communities and to our county executive and to our mayor. That's exactly what we saw when that data was released. This is about one simple thing. We're here to talk about who's being vaccinated and who's not being vaccinated. And what we know is, again, through this data, it appears that there's been a very deliberate and devastating but reversible pattern of inequity. And I say that, again, based off the data. We know that white Marylanders have received more than 4 times the amount of doses of vaccination today than Black Americans. We know that 6.6% of Black residents in the city of Baltimore have only received their first dose, when Baltimore City resident, the population is about 63% African American. We can just look at the data. What we're here is to not get caught up on, again, the emotions of talking about the vaccination hesitation in our communities, because that does not exist. We know that that is there for a segment of our communities, but the older women in West Baltimore, the older gentlemen in East Baltimore, the folks with comorbidities and pre-existing conditions, the folks who are fitting in 1A have been desperately trying to get this vaccination. And unfortunately, because of the lack of oversight, the lack of equitable distribution, and the sheer leadership, that has not happened. That is why we're here today at this emergency call. I was on the phone with my grandmother-in-law yesterday, and she said, Nicholas, these folks kept calling me and calling me and calling me until I got my vaccination. I said, Amma, wow, that's amazing. They reached out to, she said, yes, through the health clinic that I attend, they knew what my circumstances were from a health perspective, and they told me I needed to immediately get this vaccination because that's where I was in line. The reality is Maryland ranks at the bottom of the list of states associated with vaccinations. And when you couple that with the lack of vaccinations in the African American community, and when you couple that with the disproportionate amount of infection as well as death in the African American community, the reality is Black and brown communities in Baltimore City and Prince George's County rank some of the worst in this entire country. That is what we're here to talk about. We're here to talk about who's getting the vaccination and who is not. And the reality, again, is when you have data and you are triaging an emergency or a critical issue such as this, you go after your most vulnerable. You go after the issue that is going to help slow down the curse or help slow down that particular issue at that particular time. And that is the only thing that we've asked for. Prince George's County nor Baltimore City is asking for a handout. We're not here begging for anything. We're just asking our state to provide an equitable distribution plan associated with the rollout and the implementation of these vaccinations. And I'm here to just talk about 5 quick suggestions that I ask you, the Maryland General Assembly, to consider. 1, we need our governor and we need our health department to develop policies for universal data collection. We also need them to lean on vaccination equity task force to steer Marylanders in the right crisis. Remember, in that same letter where we were begging for the racial, ethnicity, and zip code data, we were also asking for that task force to be established, while Governor just established it 3 weeks ago. That's a year too late, but we're here now, so we must leverage that task force. Immediately stop counting the vaccinations that are going to the hospitals in the city of Baltimore. Baltimore City is home of Johns Hopkins Hospital, a world-renowned institution where people come from all across the world, but definitely this region right here. Why are we, when we talk about Baltimore City vaccination numbers, we also counting those numbers? Again, only 6.6% of the original vaccinations were given out to Black residents of Baltimore City here in the city of Baltimore. Next, direct the majority of doses given to Baltimore's mass vaccination sites to city residents. You heard what the county executive said in Prince George's County. We have the same exact issue here, and I know our health commissioner will attest to it. Those vaccinations are here for Baltimore City. Baltimore City residents need to get access to those. And then lastly, please take transportation equity at mind when you develop these solutions. We need peer-to-peer engagement and outreach from community-based organizations, and we need mass vaccination sites that are in areas where transportation equity is a major problem. again, to the Madam Chair and to Mr. Chair, thank you so much for this opportunity. This is a discussion that is woefully needed at this critical point. This is the discussion that we cannot not ensure that we are screaming to the top of our lungs before you guys click that bell on sine die and get out of session. This is a discussion that we must ensure that we have the leadership in both houses to ensure that we put the pressure on the administration to provide an equitable distribution and rollout of this vaccination. Last but I say that this is not reversible. We can reverse the course. We can put Maryland at the top. We can ensure that Black and brown communities are accounted for. And that's exactly why I believe you set this up. And thank you for the invitation.
Thank you so much, President Mosby. You led that fight for data. We shouldn't have had to have that fight to begin with. It should have been just automatic that we would be collecting that kind of data. But we had to fight for that. But now to what end? Because here we are still with just enormous inequities in the vaccination. So, you know, we fought that fight, we got the data. It wasn't a surprise what the data showed. And now here we are still fighting for equitable resources, fighting for, as Madam County Executive said, what we've paid for. So it's beyond frustrating. But next I want to introduce Prince George's County Council Chair, Calvin Hawkins. Thank you for joining us.
Thank you so much for this opportunity. To the chair from Baltimore City, to the chair from Prince George's County. This is a very important moment, and we are grateful that we have this chance to collaborate about a way forward. I see Speaker Jones on the call or on the virtual presentation. Thank you for being here, Speaker Jones. I heard 5 speakers before me from Baltimore City and Prince George's County lay out the reality of the situation we're facing. Instead of reiterating and enumerating what they have already said, to my state delegates, if any state senators are on the line, what we need now is, from this conversation, a plan forward. And that means a discussion with the local leaders along with the governor or his team for a way forward, because we can't keep discussing the issues that are impacting our communities without having the governor to sit down with us and say, these are the realities. The president from the city of Baltimore Council, the president of the city council stated what they are. Now, my colleagues, we need to sit with the governor, if not this week, next week, to say we need to change the approach to how we vaccinate our citizens. This has to happen before you all finish your session, because you have the power to change some of his initiatives if he doesn't change his approach. And I ask each of you to think about it, and I don't have a problem coming back, talking with the governor and all of you a way forward. The late John Lewis, who was the conscience of the US Congress, said the struggle is not of the moment, the hour, the day, the week, or the month or the year. Our struggle is for a lifetime. Delegate Jazz Lewis, as I watch you hold your baby in your hand, powerful individual in the House of Delegates. Our fight is not just for our seniors and all them, it's for our future. That little baby Jazz has in his hand. My colleagues, that's what I'm on this call about, just to talk about how we move forward as a collective body with our governor, so that the people in the city of Baltimore and Prince George's County know that we not only talked about the problems, we came up with a solution that more of our citizens can get the inoculation, so that we are just as the other 22 counties. We want the same thing. Bottom line, thank you to the both chairs for inviting me. When I get back, someone will say, you didn't read your speech. I can't read my speech. I got to talk from my heart, because that's what the people want. The people want the 5 speakers that spoke before me to continue to speak truth to power. And County Exec Alsobrooks, you know our county council is with you lockstep 100%. No error in how we're going to approach serving our citizens. And Mayor Scott, and to my good frat brother, the president of the council, I see you all are in lockstep too. And to the delegation, you are in lockstep because you called this meeting. And I'm grateful to be here, and thank you for this opportunity.
Thank you so much to Council President Mosby. And
Oh, Joy.
Chair Hawkins.
Hey.
I do. Oh, so sorry. Is that some background maybe?
Yesterday.
We'll get that situation.
Yeah, let's try to double back because I gotta listen. I want to start listening to this hearing.
Joy, I think you got
to. I got to mute someone. Just a moment. Okay, so we're good to go. But I just want to thank the leadership of our councils, Council President Mosby, Council Chair Hawkins, because I think we see the solid strength we have in our local leadership. They're all saying the same thing. We as a state, we need to step up. So before we jump in, because I think we were singing her praises before she could hear us, Speaker Adrienne Jones is still with us. I just want to make sure she can wave to us. I know she has to move on, but I think we were singing her praises before she had jumped in the Zoom. So we want to make sure that she knows that we are so grateful that she's bringing, because Lord knows we're going to need a lot of unity to make the case for what we deserve. At this point, we're going to have an opportunity for about 2 or 3 questions from the delegations.
Madam Chair, it looked like the speaker was actually off mute.
Madam Speaker?
No, I was just going to say brief. I'm very, very pleased you're doing this. This is being live streamed. You can believe me. I know that the good council president from Prince George is saying have a meeting with the governor. This is the most effective way to do this. We have had discussions with the governor. I think by both jurisdictions, or by sharing this, you got the your council people, your legislators, your mayor, your county executive, and this says a major message. And what was outlined, you can bet, I'm sure that the governor's people are sharing this. They're going to play it to him, and I think this is the most effective way. We're going to push again on our areas. We used to have regular meetings with the governor, the president, and I, but they have been canceled for the rest of the term. So that's why I'm saying, I know you meant well, but this is the most powerful way to do it. And these numbers and this cross section. So, and I thank you for putting this together, the two jurisdictions and our members.
Thank you
so much, Madam Speaker, for your leadership. Thank you so much for joining us.
Are there any questions from any members of our delegations?
You know what, I might start off if that's okay, Chair Smith. I think 2 or 3 thoughts come to mind, and one of them, I'm reading a text from one of our council members, Councilmember Danielle Galeros, and she says that not all of our federally qualified health centers in Prince George's, and I imagine in the city as well, have been given vaccines who have been certified by the state to distribute. I mean, isn't that part of what these health centers are around for? And I would like to hear from our city commissioner and Dr. Askew about that. And then two other points. In Prince George's, we have all these metro stations. It would just seem to me we would try somehow, some way, to the extent that we are distributing vaccines, to make it metro accessible. I appreciate the mass vaccination center at Six Flags, but Six Flags is nowhere near a metro station. So those are 2 points. And then this past Sunday, we had 60 Minutes. And we have the vaccine hunters, 8 or so teachers who are just taking the time out of their own schedules to track down and register senior citizens, just out of the, just because there's a need, volunteering, and doing a lot of great work, getting people who are eligible and have a need vaccinated. But why wouldn't the state be trying to do something like that, with the staff and resources that we have? So just three ideas, three points that I wonder if our health experts could comment on.
Sure, Delegate Barron, I'd be happy to comment on this. First of all, interesting that you should mention the vaccine hunters. I was actually on the phone with them on a Zoom call last night. Great group of folks, all during their dinner hour with their kids running around, but pushing back and forth ideas on how they could help us engage our more challenging to reach communities. So we are actively engaged with them. Secondly, you're absolutely right with respect to the federally qualified health centers. This is again a rule that we're finding ourselves having to work around. Basically, the issue in Prince George's County is that our federally qualified health centers have business offices located outside of Maryland. So while they serve within Prince George's County, their business office is within, for instance, the District of Columbia. So the doses were not going to them initially. We have been actively engaged with the equity office, this new equity task force within the governor's office, and we seem to be making some ground with our first two, at least the Mary Center and La Clinica, to get them on pathway to start receiving vaccine. I'll keep you posted on that if we run into any difficulties, and we're working on trying to get the same done for our other federally qualified health centers. And you're absolutely right. That's what the federally qualified health centers are there for. They serve our most hard to reach populations, the populations that find them as a trusted source, a trusted resource, and a trusted place to receive their care. Of all places to receive vaccine, they should be on the top of that list. So I absolutely agree with you there.
Yeah, I would echo what Dr. Askew said. We've advocated for weeks now for our FQHCs, or federally qualified health centers, to directly receive vaccine. They've received some quantities. At one point, we even said, we could reallocate our dose, to our FQHCs to be able to vaccinate. They are often a trusted partner. They're in underserved areas. They're very well positioned to be able to serve residents with underlying health conditions. Again, there was a federal program through HRSA that did select some FQHCs. The only one in Baltimore is Healthcare for the Homeless. I meet with my FQHCs on a monthly basis, and we'll be having a broader discussion with them during our regular monthly meeting this Friday on how we can best support them to vaccinate residents here in Baltimore City. But we're advocating for that as well. With regard to the vaccine hunters, I mentioned our older adult registry. So again, this is a registry focused on adults over the age of 65, given that they're high risk, that are city residents, that are in need of vaccine. And again, this is a call-in line. So we'll call individuals back. Our partners will call them back to schedule them. We've not worked directly with the vaccine hunters group, but certainly see the value in the work that they're doing, given just how limited this resource is. I think, the big thing is we do want to make sure, even in doing that, because of the system that's being used, PrepMod, we want to make sure those links aren't being inappropriately shared. We have experienced that, and it does lead to overbooking of clinics or inappropriate booking of clinics. So that's my only hesitation with some of those groups, that we're not inappropriately sharing links that are being sent out, so that people are scheduling when a link is not intended for them.
Thank
Thank you. The next question will be from Delegate Haynes.
Thank you very much, Madam Chair and Mr. Chair, Prince George's County. But I also want to recognize the Speaker of the Maryland House of Delegates, Speaker Jones, who is such a great force in the state of Maryland with her leadership, and also to the leaders of the respective jurisdictions, my Mayor, Mayor Scott, good to see you as well, and County Executive Alsobrooks, and council presidents. I heard some information earlier that just really stuck out for me, and we all are dealing with the same issues with elected officials here on the state level, which is the type of calls that we're receiving. I think I heard correctly that there was currently about 120,000 residents in Prince George's County that are on a list to receive the vaccination, but at the rate you're going, that number has not been realized. Is that correct? Did I hear that correctly? I don't know.
Yes, that's
correct.
That's absolutely correct.
Okay.
Yeah.
Do we have I guess this would be to the health director for Baltimore City. Do we have a similar number or data as it relates to Baltimore City? I know the numbers, the percentage, but in actual numbers, how many people do we know are waiting to be vaccinated, that's on a list, but cannot get vaccinated? And the question I'm sort of getting at is this: at the current trends that our residents are being vaccinated, just to get through the current numbers that we have on the list, how long would that take if nothing is done to resolve this issue?
So the number that we have, and again, we have our centralized registry, it has been focused on older adults.
Right.
Again, knowing how scarce the supply is, we couldn't encompass everyone in 1A through 1C, though we know many in 1A through 1C are signed up on multiple lists. So we have knowledge of our list, but we don't necessarily have knowledge of lists where people have pre-registered for a hospital site, just the list that we have for our older adults specifically.
And I think Dr. Dzirasa brings up a good point, Delegate. Something else that myself, the county executive, and other county executives have been fighting about is about that access to data for our health leaders to be able to see other things that are existing in our jurisdiction so that they can have a better picture on how to plan and properly administer vaccine as well.
And again, just kind of piggybacking off of what Mayor Scott said, that's why at this point, particularly when we talk about healthcare in our state, we should have a universal way of collecting data and a repository of keeping that data. That's the only way to ensure that from an equitable perspective, we're administering testing all the way up to vaccination and treatment in the fairest right and going after the most vulnerable. So this idea that we don't have a universal way of collecting it and there is no requirement from a state perspective is problematic.
Thank you. Thank you very much, Madam Chair.
Delegate Pena-Melnick.
Thank you so much, Madam Chair, both for having this meeting and for everyone who's here today. I grew up in the Dominican Republic, and I remember getting a vaccine for polio, when you drank that little red cup. And I remember lining up, and it was a huge line that went for blocks. And we all just lined up. We took the cup, we drank it, they gave us a little card. Okay, the same when we got our shot. And there was not a lot of paperwork. We went to the places where people lived. It is done in India, it is done in Dominican Republic, and they're doing it better than we're doing it. As we look at when you look at the population distribution for Prince George's County, we have a 6.8% variance. Baltimore City is second with a variance of a 1.8%. Other counties are generally within 1% when comparing the population. So clearly there's disparity there. So as I look at what we're going to do after this meeting, I have two suggestions. One of them is that the governor's equity task force is being led. The person in charge is Brigadier General Janine Burkhead, is an African-American woman. I met with her 2 weeks ago, and she is interested in meeting and working with the counties. I would suggest that the health officers, the county executive, the council president, and chair of the Prince George's County Council ask for a meeting with her immediately. The other thing is that the state is getting vaccination from the federal government. We should enlist our federal delegation to contact the administration, the current administration, to put some conditions and to present the numbers, because this is about equity, it's about race. And I think that the current administration will be very interested in that, if that's what it takes for the administration to listen. Thank you so much for giving me an opportunity to speak.
And if it's okay to add, we have been meeting with Brigadier General Burkhead around some of the work that they're looking to do in Baltimore City with regards to pop-up clinics. So again, one of our concerns, we wanted to make sure that our partners, our CBOs that we've been working with, our faith-based organizations, weren't confused by a new partner coming into this space. So we have had the opportunity to meet with her and ensure that those efforts are coordinated on the ground.
And I would just add, I met with General Burkhead again on Saturday at one of these sites, and we've been working, and she is fabulous. But we know, Delegate, to your point, where the larger issue lies, and I actually participated in a call with African-American mayors from across the country, where we were talking directly with Vice President Harris about this issue, about COVID, about vaccine distribution, about the inequitable vaccine distribution, where we asked essentially for the federal government to allow for folks to start to get vaccines directly to cities in order to see the impact of the inequity disappear, because we know of the issues that we're being faced with the challenges with states, not just here in Maryland, but across the country, and not understanding the severity of how this COVID is impacting Black and brown communities at a higher clip, and we're dying at a higher clip. So we need to have that deeper focus on our communities that does not exist. And I think that was well received by the Vice President.
Yeah, the data is clear. It's so clear for Black and brown communities. So we need to just elevate it. Thank you.
And Delegate Pena-Melke, as you'll know, I think General Burkhead and I have each other on speed dial these days as she works to address and help us address some of the disparity issues that we're seeing here in the county. And we were there together as we had the event a couple of weeks ago. But I'm in contact with her a few times a day at this point, really working hard to try to figure out solutions. And she's really got her shoulder to the wheel on trying to help us.
Delegate Boyce, can you make your question pretty quick? We do have to jump to a second.
I do. Yes, I can.
And
it's just an observation that I made that I certainly don't understand. If we're getting vaccines in our respective areas, how is it that others outside of our jurisdictions can come in and get the vaccination? And while I am not trying to encourage additional disparities, what I am saying is that if we're creating all these sites in our cities for our city residents to gain access, how is it and how do we unfortunately stop. If you're not a city resident, if you're not a Prince George's County resident, then you need to go in your respective areas to get your vaccination, because I'm hearing people go as far as actually leaving the state, right, and going to Pennsylvania, but also being like, in opposite ways too, respectfully, people who are leaving the city and going to go get their shot in Montgomery County or whatever it is. It's a mess. And if we're going to quote unquote treat our numbers and our people, I think it's important. And I understand that people are desperate for the vaccine, and I'm happy that people are excited now about this and not as fearful as, but how do we limit? I mean, I think one of the ways is that we have to potentially restrict it to the jurisdiction. And I just want to put that out there. And the second thing I want to put out there is the second shot issue. A lot of these places are so across the state ready to give that first injection, and you've got seniors leaving with a card saying, call to make your second appointment, when they should actually be leaving that site already scheduled for a second appointment. So I wanted to just talk about that and lift that up a little bit to figure out how do we just secure, again, it was hard enough to get the first appointment, to assure that we're securing their second appointment. Thanks so much.
Delegate, I guess I'll start. We share that frustration, right? You heard me talk about a story last night where someone in County Executive Alsobrooks jurisdiction that is friends with a senior here was sent here, and the person here was sent there. We have asked for 50% of the doses that are given out at our mass vac sites here in the city that are run by the state to be given to Baltimore City residents. That has not been accepted. That is a part of the issue that we're having here, because we're creating this system that is broken in so many ways, that is not focusing through a lens of equity and not even in the jurisdiction. We heard from County Executive Alsobrooks and myself, heard from some of our counterparts on the Eastern Shore who's saying, listen, this system is so messed up. They're actually vaccinating people in Delaware with our vaccine. We know that the system is broken. I'll let my health commissioner talk about some of the other restrictions and things that have been in place, but I know the county executive shares that same frustration, because it's about us being able to make sure that our people get it, and the system as it is given to us right now does not allow for that.
Yeah, and I just want to chime in, Delegate Boyce. We do share the same frustration. I don't know if you got to hear us say, if you can believe it, 90% of the people who have been vaccinated at the site in our county don't live there. And you know what? And I don't begrudge the people who have come there to be vaccinated. They want to live too. They want their family members to be safe and to be healthy. And part of the issue is that we have the largest jurisdiction in the state does not have a mass vaccination site. So many of those individuals who, like us, want to be safe and want to have this resource have used the site to get an appointment. I don't begrudge any person who wants to have an appointment. We just ask that in our own jurisdiction that you should be able to get an appointment. Can you imagine if I set up a resource in your front yard at your house and then told you that only one of your 10 family members could come outside and get the life-saving resource? That's the situation that we've been placed in. And we did contact the state. We've been asking for, we did ask for the same thing Mayor Scott did, 50% to reserve for us, or just reserve specific days that only Prince Georgians can be served at that particular site. What we've been told so far, and we'll just be awaiting additional answers back. We have requested that, and what I heard back so far is that apparently they would set aside 500 per week. And I believe it's 2,000 administered per day, and we would be broken off, so to speak, 5 per week, 100 a day. That's not going to work. So we're hoping for a different solution. We think one is forthcoming, and I think, explaining this together and expressing our concern together, certainly I believe will help us to make the case and to get the resources we need. At the end of the day, everybody wants the same thing throughout the state. We all want our family members to live and to be healthy. And we're just asking that if this resource is right there in our own county and city, that gosh, shouldn't we be able to take advantage of the resource?
Thanks. And I would just quickly say, if that's not the case, then we should be asked to being reimbursed by the jurisdictions of the individuals we have inoculated. So they can reimburse us with the vaccine for our people. So I'll leave it at that. Thank you, Madam Chairs and Mr.
The only thing I'll add, if it's okay, I know we're running short on time, is I mean, I think this speaks to the larger issue of a lack of some type of centralized registry, so that you are signing up in multiple places and you are going wherever the first available vaccine is. Again, I don't fault people for doing that. I understand, but without a centralized system, it will continue to happen. I think that, you know, the second piece of this again is one of the things that we're focused here on in the city is that appropriate matching of resources. Knowing that it's limited, we really want to focus and be intentional. And because we're local, we are hyper focused on our older adults, and that's how we've been able to focus our clinics and our mobile efforts. And again, the state sites, I understand they want to get as many people vaccinated as possible, but there's also this need to be very hyper focused on the communities that have been hardest hit and aren't always best served by a mass vaccination site.
Thank you so much. I just want to say thank you, thank you, thank you, thank you to have our, you know, mayor, our county executive, to have the heads of our councils, to have our health officials here. It means a lot. I know we all know we're not in it alone, but bringing us together, this just reinforces that united we are mighty, and we're able to do what we need to do on behalf of the people we represent. So I just want to say thank you, thank you, thank you for taking the time, and thank you to the speaker who I believe had to leave. We are going to be going into a new phase, a second panel. So at this time, I know we'll be hearing first from Dr. Sherita Hill Golden, who serves as Johns Hopkins University's Chief Diversity Officer, also Professor of Medicine, and has been engaged from the very beginning around issues related to vaccine development and administration, and working with our community leaders to figure out how best to connect them to the opportunities. So I want to give Dr. Golden an opportunity to share at this point about 3 minutes or so for the panels to come.
All right, so I just want to first thank you all for inviting me, and to Delegate Smith for inviting me, and to all of you for your leadership. I grew up in Prince George's County, Maryland, and was just in Upper Marlboro this past weekend. And for the last almost 27 years, I've practiced medicine in Baltimore City. So I have two homes, so I'm happy to present to you. And I just have a couple of slides that I wanted to share. What I'm going to do is give an overview of our community vaccine equity efforts. I'm just waiting to be able to share an overview of our vaccine equity efforts that might be things that we could advocate to the state to help support the things that are needed. So, you know, there are a couple of areas that we started thinking about this. And in the interest of time, I won't share this information, but, you know, initially, because healthcare workers were the first to get allocated for vaccinations, that we actually had to make sure we reached all of our frontline staff. And many of our more challenging to reach frontline staff were Black and Latinx. So we had an entire vaccine equity strategy around our employees that has worked really well. But then I'm going to share our patient equity outreach. So one of the things that became very clear with many of the processes required to sign up for the vaccine being electronic is that we, you know, we're using in our electronic health record, we were requiring people to use MyChart as the way to sign up for the vaccine, but recognize there's a significant proportion of our patient population that had inactive MyChart accounts. So once their vaccine ticket was pulled, they wouldn't necessarily know that their ticket had been pulled. So what we did was set up a call center that once a patient was identified that you've been pulled for a vaccine appointment, the call center called them and set up that appointment, went through all of the registration on the telephone. So they then would not have to figure out how to do all of that through the electronic health record. The other thing that we did is that we did outreach to what we called our priority equity clinics that we know serve high-risk marginalized communities in East Baltimore. And that met our Maryland state eligibility criteria. And interestingly, when we reached out to these clinics, again, a large proportion of Black and Latinx patients in the city, that we had actually a fairly high yield of phone call to scheduling vaccine appointment. So that direct outreach, particularly from clinical settings that knew those individuals, was very powerful in helping to actually set up an appointment. And because we've been administering Pfizer and or Moderna, to the point that was raised earlier, we made sure that people had their second appointment when they left the first appointment clinic, because that's a very important issue. So I'll spend the last couple of minutes talking about our community-focused equity outreach efforts. So we have had several. So one we did in partnership with Baltimore City Schools, where we used a portion of the allocation that was allocated to Baltimore, or to Johns Hopkins Medicine from the state, to help vaccinate our Baltimore City public school teachers, as well as the personnel who work in the city schools. And that was a very effective outreach. And then recently we partnered with Sibley. So Sibley Memorial Hospital is one of our health systems hospitals. And we partnered with the DC Department of Health, as well as the DC Housing Authority. And we targeted 6 senior housing buildings in Washington, DC. And we're actually just launching a similar effort in Baltimore City. But these are some of the images from the vaccine clinic that we did in Washington, DC. So basically the common areas and some of those senior housing complexes were converted into vaccine sites. And so, and what we realized in going to those sites is that many of these individuals were in wheelchairs, they were amputees, they had transportation challenges that they would have never been able to overcome had we not actually taken the vaccine to them. So these are our GO teams that help to set up those vaccination sites in senior housing. And what our data have shown us is that 88% of those that we vaccinated were African American. So we actually reached the communities that we wanted to reach. And so consequently, we're now partnering with the Baltimore City Health Department to undertake a similar effort with Baltimore City Senior Housing and launch the first clinic last Thursday, where 101 individuals were vaccinated. And this is going to be an ongoing project because we recognize that this is a way for us to partner with the city and potentially the state in reaching those marginalized communities that are most in need. In addition, last Friday, Dr. Kathleen Page, who's been our Latinx Health Equity Champion, helped to launch a COVID vaccine site at Sacred Heart Church of Jesus over in Highlandtown. This is an area with a very high positivity rate among our Latinx population. And this is specifically targeting that community because this is their trusted community partner. That site was launched on Friday and there were 176 vaccinations delivered. And again, the staff here are bilingual, and so that really has helped with the communication. Many of these individuals have been signed up in my chart already because we had signed them up in the summer when they came to Sacred Heart for COVID-19 testing. So because they were already in our system, we were able to reach out to them for this vaccine initiative. And then the last thing that we've really been doing to address the vaccine hesitancy, and I agree with much of what has been said, that as more Black and brown individuals are getting vaccinated, there is less hesitancy because now someone knows someone who's gotten the vaccine and has benefited. So we have really been partnering again on education outreach to our community. Dr. Katie O'Connor is one of our emergency medicine physicians who is the point person in our unified command center for our Baltimore City housing project. And then Jean Hitchcock, who many of you probably all know, who is just an outstanding advocate, has been our government and community affairs representative for the Baltimore City Housing Vaccine Project. And so she and I have been collaborating with others that are shown here, Drs. Kathleen Page, Dr. Risha Irvin, Dr. Lisa Cooper, and Nancy Malello. So we now have a combined community education outreach that includes not only our government and community affairs, but also our Office of Diversity, Inclusion, and Health Equity that I lead, our Central Soul, as well as our COVID Faith and Community Leadership Group and the Urban Health Institute. So. And then we actually have a website that will launch hopefully sometime this week. And I hope this shows up. I can be a little, it's showing up now. I'm technically challenged, but this is our COVID-19 health equity information. So all of our Johns Hopkins Medicine health equity initiatives, the operations of them will all be reachable on this one particular website. And we hope that this will be a valuable resource as we think about, how we might partner with the city and the state to to expand access to our vulnerable communities. So I will stop sharing.
Thank you, Dr. Golden. You did that. It was a lot of info. You did it quickly. I appreciate it. We're going to push through to someone that's very familiar to you, of course, Dr. Golden, to some of us as we participate in the Black Caucus. We're going to hear more from Dr. Nicolette Lewis-Saint, Executive Director of Healthcare Ready.
Thank you for
hearing from you. So thank you. And I also want to lift up, because we haven't had an opportunity to engage on this piece around intersectionality, is that obviously communities of color, particularly Black and Latinx, are having a hard time accessing the vaccine. But there's also increased exposure for LGBTQ people of color, both to the virus and limited access to the vaccine. So I just want to lift that up for the good of the order, that there's a lot of different fronts that we're navigating here. Without further ado, Dr. Lewis-Saint.
Thank you for having me, Delegate Smith, and I appreciate the invitation. I'm looking at the time and I'm going to do my best to stick to the 3 minutes. I know there's a lot to discuss. And with that, I just want to start by saying this is very difficult. And I want to acknowledge the complexity of the challenges that we are all facing, but certainly our public health partners. And as somebody who deals in disasters and disaster response and supply chain, recognize that we're dealing with a myriad of very complicated systems. And so as I always like to tell our partners, if there was an easy solution, we would have found it already. So it's really important to understand that there are complexities that are literally laying on top of each other that are complicating our ability to do this as seamlessly as we would all desire. But with that, I want to really point out some piece of nomenclature that I think is really important when we talk about this. Delegate Smith knows me well and knows that I am truly an engineer at heart. And when we talk about the distribution of a vaccine, I want to point out that really what we're not talking about is the logistics. And actually, based on what we've seen from our public health partners even today, the administration of the vaccine is actually really well worked out in Maryland to be able to, specifically in PG County and Baltimore City, figure out ways to get to people who need it most. What we're talking about is allocation, and that's really the first step of this. And so when we're thinking about where the equity challenges are, we know how to move the product. We know how to figure out ways to get not just people to vaccine, but vaccine to people. What we have to figure out is how to infuse equity in allocation. And so I just want to hone in there, because that's really the front end of this, and that's what we're talking about. And as someone who works at the national level, looking at how we are coordinating this across the nation and really globally, what we've seen is that we've been pushing for a national strategy, but what we've ended up with is what we've called a 50-state strategy, which means that if you see one strategy, you've seen exactly that, one strategy. And what I would encourage, and I believe our city council president mentioned this as well, that centralized system is really important for this, because what we have to shy away from is a tendency to look at this as a jurisdiction by jurisdictional issue. The reality is that we got into this pandemic together, and we have to figure out how to actually create a vaccination plan that deals with allocation, distribution, and administration as a state and not just as jurisdictions. And that does include strategies such as making sure that at the mass vaccination sites and the community vaccination sites that are being stood up by FEMA, that we do have the ability to ensure that we're protecting those jurisdictions. But it also means that it's not enough to just have a county level plan. We really have to look at this holistically. And we also have to do that in how we communicate to our residents, recognizing that right now we're in a position where we have a lot of demand and very little supply. But that's going to change, and it could actually change very quickly over the next couple of months. And if we're not intentional about how we do that communication, what we could find is that we have supply that individuals are not willing to use. And that's what we want to shy away from. So when we're thinking about that allocation, there's a communication piece there as well, but thinking about how these plans build out at the state level is really critical to being able to have a successful vaccination campaign. In the last minute, I just want to point out that when we are talking about equity, it is complicated in the disaster context for multiple reasons. It's not enough to look at racial equity. It's not enough to look at health equity. And when we define intersectionality in vaccine equity and allocation, we have to think about a number of frames. The one that we use at Healthcare Ready is looking at the intersection of social vulnerability and medical fragility. And what that means is that it's not enough to just look at how an individual's health status may be creating vulnerabilities. It's also important to look at the vulnerabilities that surround them as it relates to where they work, how densely populated their communities are, whether or not they have the luxury of being able to work from home, if they have people who are over the ages of 65 or 75 in their household. Those dynamics are a very important part of this. And so when we're thinking about who is most fragile, who is most vulnerable, looking at that entire lens and opening up the aperture to understand that this is complicated. We're dealing with scarce product in a time where everyone ultimately has a need. And then the last point I'll just make is that as we're thinking about hesitancy, I've heard this come up a bit, and I just want to point out that what the data shows is that the individuals that we have, I would say unfairly painted as being those who are hesitant to take the virus, never said they wouldn't take the vaccine rather. They said they wouldn't take the vaccine first. And so what we are seeing is that months after the rollout, we are also seeing that the data continues to reflect when being asked in the state of Maryland and nationally, will people of color, will people who've been historically marginalized take the vaccine? The answer is yes, because they never said they wouldn't. They said they didn't want to take it first. And so now that we're at a point where they would not be taking it first, I think we do ourselves a disservice to think that we are accounting for hesitancy in the allocation planning. The reality is that that is simply not the case, and there is data that presents that. So with that, I see the floor, and I thank you all for your time.
Thank you so much, Dr. Lewis Saint. We appreciate you. That was very quick and chock full of really good information. So thank you. Just speeding right along just want to make sure that our next speaker is with us. Is Reverend Dr. Boyer Freeman with us? I think I saw him.
Good afternoon, Madam Delegation Chair.
Oh, great to see you. Thank you.
And to our distinguished Speaker of the House and all of you who are assembled here in the leadership for our state. It's an honor to stand on behalf of the African American Clergy Medical Research Initiative that was invited to participate in the Maryland Department of Health's Community Stakeholder Advisory Group back in the fall of 2020. Every Monday, we sit at the table with the leadership of the Maryland Department of Health, the acting deputy secretary, and others who are part of that operation that have invited us to come in and to give our input to their efforts around first communication, the communication plan associated with that, and then as vaccine came on the scene to deal with vaccination and vaccine distribution and those processes. And so it was decided that it would be best to divide this group of 100 persons who meet on Monday into several subgroups. We're 12 subgroups, and I've been asked to serve as the lead of the Black community subgroup that has been meeting weekly on Tuesdays since the first of the year. And we have submitted several reports to this larger group that goes to our Secretary of Health as well as to the Office of the Governor, with several asks that we continue to wait for any type of response, answer, or action. And so you know the statistics where Black communities in Maryland represent 29.5% of the population, but we're overrepresented in COVID-19 deaths at 34.5% and underrepresented in COVID-19 vaccinations at less than 15%. And so we've had several observations that have led to the recommendations that we have put forward to the state of Maryland. And we are not only clergy, we are also physicians, other clinicians. We are university professors that focus in pharmacy and health-related matters, and we are other community-based organizations such as NAACP branch presidents from around the state and other front-facing organizations and entrepreneurs around the state. And so our observations indicate that the Maryland Department of Health and the Governor's Office are neglecting our state's hardest hit communities. quite frankly, what we have discovered since the fall and all the input that we have put there is that in this process, there is a tone deafness as it relates to the Maryland Department of Health responding to hearing our recommendations that have been written and submitted to them on several occasions and giving any feedback that would indicate that they are moving in a more equitable direction. We are a data-driven organization, and so we do our research and we bring back information based upon what has been indicated by the data. And so we have made several asks. In fact, we've made 10 to the Maryland Department of Health that I'd like to share with you. One is advance the timing of deliverables, because early on we were told we were going to wait and see how things went, but we are living with the fierce urgency of now. As you all know, this pandemic is deadly, and the longer we stumble, fumble, and try to figure out, the more people die. And by and large, those people are dying in Black and brown communities. And so we have asked the state to apply an equity lens to all COVID-19 related efforts, including transparency of allocation of financial resources and supply chain diversity of COVID-19 efforts, vaccine distribution criteria, mass vaccination site selection, vaccination reporting, composition, and a non-military/law enforcement leadership of the state's COVID-19 equity task force, in particular in Black and brown communities, where we have not had a favorable and helpful relationship with law enforcement entities as it relates to them administering this particular program. And so we are asking for sensitive approaches to communication, sensitive approaches to administration that will move our people away from this notion of vaccine hesitancy, if you will. In fact, our position is that we should normalize vaccine hesitancy based upon our experiences historically, but not just historically, with what we have been dealing with in our current dynamics around healthcare access and healthcare equity. And so we are pushing to advocate at the county, state, and federal levels for immediate adjustments to vaccine rollout criteria, such as applying existing level 1B comorbidity criteria to include race and ethnicity consistent with reported infection and morbidity rates, and to distribute vaccination allotments to Maryland jurisdictions in proportion to cases and deaths. So we don't believe that in jurisdictions like Baltimore and Prince George's County that we have already received more than our share. We know that we have not gotten what we need at such a time as this. To improve transparency and build trust by announcing vaccine rollout stages at county levels and at the city level, only reflecting reality of vaccine availability and distribution infrastructure, and plan for vaccination of incarcerated residents who are in our jails, our prisons, and in our youth detention centers. We've asked the state to invest in a centralized system of vaccine registration. As you know, I don't need to recite the litany, that the registration process is helter-skelter and it is all over the place. We've asked to fund, empower, and support local health departments to lead the way in partnership with grassroots organizations that know their communities. As we're talking about these mass vaccination sites, I serve as a pastor in West Baltimore. And so they're beginning to discuss utilizing the faith-based community as access points for vaccination. Deacon Reed and Mrs. Davis, who are in the New St. Mark catchment area, would find it much easier to walk to the church and speak to someone that they have known, that they trust, who can give them credible answers and convince them that this is the best thing for them to do, not only for themselves and for their family, but for the community at large. And so to prioritize local health departments for vaccine distribution, and data show that they have the highest percentage of distribution rates. And so we have asked the state to commit to full and effective data gathering as a key basis for ensuring equity, require all in-state vaccine distributors to report to local health departments and Maryland Department of Health daily criteria related and demographic data on all individuals receiving vaccinations by appointment and walk-in, including rollout levels, race, ethnicity, age, and residency. Provide immediate written guidance to vaccine distributors to provide vaccines to intellectually disabled residents without question, in line with long-established flu vaccine protocol. The protocols already exist. Give us what we need. To adopt and promulgate a scientifically appropriate and socially just lexicon and analytical approach for minority groups, public health research, analysis, planning, discourse, and intervention. And to shift current messaging elements immediately consistent with existing research and best practices, starting with the state leadership. We should normalize, not criticize, vaccine concerns. In all planning meetings, messaging, and front-facing communications, set an expectation that everyone involved in COVID-19 relief and vaccination efforts explicitly acknowledge and address the validity of any and all residents' concern, as well as the ongoing COVID-19 learning curve, such as disease variants, vaccine reactions, development of new vaccines, and rollout issues, and to establish responsible, data-driven, consistent, and trust-generating messages, starting with the governor's office. Stop damning the scientifically community's single greatest disease prevention message of wearing the mask. The masks are the only thing we have until we can get a vaccination. And so we don't want to wear the damn mask. We know the importance of wearing the mask until we can receive what we know we deserve. And so finally, beginning in the month of February, we wanted to engage in community conversations about rights and responsibilities when returning to work and education spaces, which is what the state is wrestling with now, and partner with state legislators to sponsor ongoing town hall meetings across the state to understand residents' concerns about vaccines related to employment and leave policies, and to discuss proposed workplace legislation as it evolves, and to focus immediately on frontline workforces, including large and small health and childcare workers, emergency service providers, public and private educational institutions of all levels, retail employees, transportation workers, and plant workers. And so we have submitted this information to this working group that we meet with on a weekly basis. And heretofore, we have received no responses to any of these data-driven concerns that we have put on the table at the invitation of the state of Maryland. And so we are speaking to you today, asking you to do what it is that you do to move this needle and get this thing off the dime, because there is a fierce urgency of now. I thank you for your time, your attention, and we pray that the Lord would continue to bless you, that as you are blessed, you will continue to be a blessing to the state of Maryland and to somebody else. Thank you so much.
Thank you so much, Reverend Freeman, for all of the hard work you've been doing. This has been an important opportunity to look up, because we know you've been communicating to our great state leadership, but sometimes we have to help brothers and sisters get sunlight on their hard work so that people can be informed that people have known what to do, because people like you have been there sharing good information all along. So we hope to be an amplifier of this work that you're doing. So thank you so much. We only
thank you.
Speakers, and without further ado, I want to make sure we recognize George Escobar of Casa de Maryland.
Thank you so much, Chairman and Chairwoman. Thank you so much for the invitation to this really important conversation. That's going to be a hard act to follow, but I will do my best. So, I mean, obviously, as you all know, there's long-standing social, economic, and health inequities across our communities have been a great contributing factor to the disproportionate impact that COVID has had on communities of color. We know this is especially true in the Latino community, where more than 1 in 3 Latinos in the state are uninsured, and at present are far more likely to acquire the virus than any other racial or ethnic group. Now, we know as this pandemic has wrought at unprecedented levels of pain in Black and Latino communities, early vaccination distribution data indicate that we can do much more to address these disparities. And in fact, we're seeing these disparities being exacerbated by this distribution. Currently, state health data indicate Black residents are nearly twice as likely to acquire COVID-19 as compared to whites, while Latinos are 3 times as likely to test positive for COVID-19 currently in the state. It's gotten to such a horrible extent that nearly 1 in every 10 Latinos in the state of Maryland has acquired the virus. And we know that is a vast undercount. But according to current data we have, 1 in 10, nearly 10% of the entire Latino population in Maryland has COVID-19 or has acquired it. And yet the vaccination data reveal that we represent slightly more than 3% of those that have so far received their first dose. So what do we do to address the situation? Of course, as we've heard today, nothing less than a comprehensive, dedicated, and targeted effort will do. One in which we rely on data, best practices in the field, and leverage available resources that should be reoriented. Now, this isn't just a question of getting more vaccines, but in also how we conduct this distribution. So we recommend the following elements. Firstly, I mean, there are a wealth of trusted organizations working in the very same zip codes where we see the highest number of infections. These organizations, faith-based and community-based organizations, should be brought into and made direct partners and conduits to the public health delivery system. We first have to ensure that we're targeting those vaccines for those exact communities and have a commitment to deliver those vaccines in those communities, not adjacent to them, not through mass vaccination sites that will be targeting them, but physically within those communities and within those zip codes. In the Latino community in particular, we recommend targeted outreach, community education, and awareness campaign. And this must be provided in a culturally proficient manner. We know this is critical to the success of any public health campaign, and we know this is necessary to convey the safety and the efficacy of the vaccine. But I think, as we've heard today, I think it's important to outline that although vaccine hesitancy does exist in the Latino community, that should not be used as a reason to excuse the devastatingly low participation of Latinos in vaccination efforts so far. As you probably know, our community is just emerging from years of persecution from the federal government, the very same entity that put together this virus and created it. For many have been threatened even to merely access our health and social services data infrastructure with deportation through the public charge rules and other federal policies that we've seen implemented that still exist today despite the change in the administration. An awareness campaign has to address those issues. Now, secondly, appointment navigation is key to our community. We experience language barriers, computer literacy, lack of familiarity with a public health system that a third of our community is not even engaged in. All of this necessitates additional navigation assistance. Now, the way we have been successful in the past to do this is through creating dedicated hotlines, having experts man these hotlines that are bi and trilingual. We have a sizable West African immigrant community as well that speaks French. Having individuals that are staffing those hotlines that are knowledgeable about the barriers experienced by immigrants is really key. And of course, access to data is among the most important tools that we can use, specifically contact tracing data. We know these contact tracing data is full of Black and Latino individuals in them. To optimize and target outreach to those most vulnerable, access to contact tracing data and information is key. We understand that there may be some HIPAA restrictions that prohibit access in many aspects of the state-held contact tracing data, but a practical method can be established to help identify those most at risk, those that have had multiple attempts to be reached out upon, that have multiple risk factors. And we know we can leverage the COVID link infrastructure and the data collected through those means, which we know will prove a valuable tool in order to target our outreach and reduce disparities. Of course, we support mobile vaccination units. It's an approach that will help address transportation issues that many elderly Black and Brown community members currently face. Mobile units will allow for a more flexible approach and can be easily adaptable to change to the realities of the pandemic, able to schedule vaccination events, pop-up events in the hot spots of the moment much more quickly and in a much more efficient way than a fixed site over the long term. I think one thing that's important to remember, especially in our communities, is the presence of multi-generational and mixed households. Now, we know in many of these households, we have individuals that are multi-generational, right? In an approach in which we're targeting only one member of that household, as in the case of the priority categories as laid out right now, are just not going to address those that are most vulnerable. We have grandparents taking care of grandchildren. We have individuals, those individuals that are younger, of course, more vulnerable because those are the breadwinners. Those are the ones that are still putting themselves at risk, accessing public transportation, still working to bring income into the household, and subjecting those elderly individuals to additional risk. So only vaccinating one individual when we have an opportunity to vaccinate an entire household is not an effective strategy, especially in communities of color. And also, ultimately, resources have to be put into place to coordinate these partnerships. I think in order to effectively address these disparities, we got to bring in faith-based partners, community-based partners, working hand in hand with our public health infrastructure in a coordinated way in which data is shared, in which communication is seamless. And for that to happen, there has to be some resources dedicated to that partnership coordination, resources dedicated to data and evaluation to really evaluate what interventions are the most successful, how to adapt to the changing realities of the pandemic, and what best practices are happening across the country that we can implement here locally. So all in all, we thank you for your efforts. We thank the different task forces, the Vaccine Equity Task Force. We've actually been able to engage with them, and are here at CASA, we're trying to work at partnering with them in several pop-up events. We actually had an event with Prince George's Department of Health, which was fantastic here at our location in Langley Park. And with about 3 days notice, we were able to bring in 100 people. So again, it's another example of those community-based partnerships, being able to effectively address these issues and effectively bring in our community to be vaccinated in an expedited manner. At CASA, we have a membership base of over 100,000 in the state alone. These are people that we have direct access to, contact information, demographic information, morbidity information because of their access to our various health programs. So partnering with community-based organizations is your direct link to those communities, and the ability to stand up effective clinics is something very attainable through these partnerships. So again, thank you so much for your time and for your efforts. And at CASA, you have a willing partner to address all of these issues.
Thank you so much, George. And just thank you to Casa de Maryland for, gosh, again, like all the other presenters in the second panel, you've been there from the very beginning of this crisis, working on the streets, right there with community members, right there with families. So just thank you for all the work that you're doing. And last, but certainly not least, is Reverend Kobe Little of the Maryland State Conference of the NAACP. He will close out this panel, and then we'll open up for questions. Just as a point of privilege, it has been a tremendous honor to pull together with my colleague Chair Eric Barron this emergency meeting, because this was pulled together in less than 24 hours, and you all answered the call, and we're just so grateful for all of you. I actually have to run to another appointment, but I just want to make sure everyone knows that this is the beginning of compiling the recommendations we have here so that we can go to the next steps. So just thank you to my colleagues for your flexibility, and thank you to my colleagues in Prince George's County for joining forces with us. It's been a great evening of learning, and we're going to win, and we're going to make sure we're protecting our neighbors throughout Maryland, but particularly the ones that are most exposed. So I just want to thank you for allowing me to be part of your evening, and I will give the rest of the show to Reverend Little and my colleague, Chair Barron. Thank you all. Have a great evening.
Thank you, Madam Chair, and thank you for your leadership. Thank you, Mr. Chair, and thank you for your leadership. Delegates, good evening. My sisters and brothers, good evening. May the Lord bless us all. I am Kobe Little, and I'm here not to repeat what's already been said. I stand in agreement with almost everything that's been said, but I would like to talk about the equity issues in terms of what's at the root of these equity issues, and then what the next steps are that we need to take. Let me start by saying that white supremacy and structural inequity are a public health emergency, and we cannot shy away from speaking that truth. And we call on each of these delegations to pass resolutions acknowledging that, and also encouraging the jurisdictional governments to do the same. We cannot end the pandemic or successfully roll out and vaccinate our populations without addressing the equity issue. And for too long, the state has attempted to sidestep, to pass over, to gloss over the equity issues. But at the end of the day, white supremacy and structural inequity are at the root of these equity issues. And if we don't call it out, if we don't address it, we will not be able to address the equity issues. Because at every point along the way over the last 12 months, where we have tried to engage about vaccine, about virus awareness, about virus response, about vaccine awareness, about vaccine rollout, our efforts have been complicated by the impact of white supremacy and structural inequity in the administration of the Maryland state government. The next point that I would like to make is that we must have the science and the public health expertise as the driving factors in our vaccine rollout and in our virus response. That is not happening right now. Right now, what we are seeing is a politically driven campaign that's focused on photo opportunities and good headlines. That will never meet the needs of our community. It will never meet the needs of the Black and brown communities in Baltimore and Prince George's County or anywhere else in the state. And we need our elected officials. We need you all to be our advocates. We need you all to speak truth to power. We need you all to call out the white supremacy that keeps manifesting itself in ways that cause us not to have access to the vaccine, not to have access to the information that we need, not to have the financial resources that we need. I'll be quite frank. The Maryland Department of Health is not driving this effort. This effort is driven from the governor's office. And the problem there is that the governor is not a public health expert, nor is he a scientific expert. And so we need legislators in their capacity as oversight leaders to be putting the state on notice that there will be better oversight and that they will have to be accountable for the policy decisions that they've made and the policy decisions that they're implementing. The tone deafness that you've heard of does not start at the Maryland Department of Health. It originates at the highest level, which is why every other week there is a press conference where the governor stands and says something that exacerbates the inequity that we're already experiencing. The most recent statement, I think, was that Baltimore has received more vaccines than it deserves. The truth of the matter is that all of us deserve all the vaccines that we can get, period. And we need our elected officials to push back on a governor who's more interested in transactional opportunities than he is in building relationships and meeting the needs of our people. Now, one of the reasons that we continue to have inequity is because the money isn't right. If we have inequity in spending and contracting as it relates to the supply chain and the rollout and the conceptualization of these campaigns, we will have inequity in the output of those efforts. And as a result, we will have inequity in access to the vaccines, inequity in access to all of the other resources that will allow us to respond and in the future recover from this pandemic. And so while we're talking about vaccine response and while we're talking about vaccine rollout, we also need to have on our mind, and we need to be preparing and building the infrastructure for our long-term recovery from this pandemic. And if we're not clear that white supremacy and structural inequity are driving the inequity that we're experiencing now, then we will also experience inequity in our recovery efforts. So it's very important that we do normalize and embrace hesitancy. What has happened with the question of vaccine hesitancy is nefarious. It has been conflated with, this issue where Black people have very real reasons for why we're hesitant, both historical and present day issues. This issue has been used to say that we don't want the vaccine, when that's not the case. But not only is that not the case, it's used as a cover for why the state has not sufficiently supplied us with the vaccines that we deserve and that we need. And so we have to call this out every step of the way. Otherwise, we'll continue to see press conferences that introduce confusing information to the equation in an attempt to obscure what's really going on. And what's really going on is that white supremacy and structural inequity are driving the way this rollout for the vaccine happens. So let's talk for a few seconds about next steps. Before I say anything else about next steps, I want to challenge our delegates to stay focused on the data for those behind the walls. The people from our communities who are incarcerated are absolutely the most vulnerable people in this entire equation. Let me say that again. The Black and brown people who are incarcerated in the state of Maryland are the most vulnerable people when it comes to the coronavirus, because they do not have control over their own locomotion. They do not have access to communication. They do not have access to their own healthcare providers. They rely completely on the state for that. And as state leaders, we need you to weigh in to make sure that we have the data about how many Black and brown folks are getting the vaccine behind the walls, and about all of the other information pertaining to our people behind the walls. It's incredibly important that that is a focal point. We need a declaration from all of our leaders, not only on the question of white supremacy as a public health emergency, but on the demand that the supply chain and that the purchasing and procurement of the vaccine rollout and the entire viral response is reflective of the state of Maryland. What does that mean? That means that Black and brown people should, at the very least, be getting contracts equivalent to our representation in the state. It means that Black and brown people should be at the table not as subcontractors, but as primes in the development of messaging and the development of strategy and all the other aspects of this response. If we're not getting paid to participate in this work, then we're not empowered to show up as our best selves with our best ideas. And I can tell you, having participated for months in work groups with the state of Maryland, that the best ideas that Black people could bring to the table are not there because we're not brought on as primes. And the subcontractors, the Black subcontractors, their loyalty is not to our people or to the needs of our communities. Their loyalty is to the people who the primes who bring them in to the equation. And so we need you to use your oversight duty to get the data for us. How many Black businesses are involved in the coronavirus response? What percentage of the money that's being spent on the coronavirus response is going to Black and Latinx businesses? And while I'm at it, trust and believe that it's not just Black and Latinx people who are being left out. It's also the disabilities community. It's also our First Nation sisters and brothers and other people from immigrant populations and other people of color. We must see multiple faith and community-based vaccination sites. We must see that, not just one or two mega churches. We've got to have these mobile vaccination units that we've heard about. We need those rolling out. The work that they're doing at Hopkins, great work. We need the state to be doing that everywhere. Now, let me talk about this equity task force for a second. It's critically flawed, and we need our elected officials to call it out. There is no one on that task force who doesn't report to the governor. And therefore, there's no one on that task force who is empowered to speak truth to power and to tell it like it is. And so it is critically important, if we're going to eliminate inequity, that the equity task force is actually inclusive, and that it includes true equity voices that have been working on equity and inclusion issues around this virus from day one. It must include people from state, not only from the state government, but it also must include local government leaders. Otherwise, there's no equity in the power dynamic. It's absolutely important that task force be inclusive. And I challenge our legislators to call for additional members on the governor's task force. And I'm going to close with one final thought. There's a lot more I could say because there are a whole lot of problems. But what we need right now for Black and brown communities, what we need right now for Baltimore City and Prince George's County, what we need right now for our brothers and sisters in these other jurisdictions is a $25 million action fund, a $25 million emergency action fund that would equip the organizations that have been doing this work. Just like my colleague, Mr. Escobar has said, the organizations that are on the ground, that are working with our communities and creating equity, even when the state is stale on the question of equity, we need to resource these organizations so they can properly do the work that they're doing. We will not be successful as long as this is just a state effort. The state needs to release funds to empower community-based organizations to do this work. And while the state is doing that, we also need to be calling on all of our corporate partners to follow, all of our corporate and institutional partners to follow the good models set by institutions like Johns Hopkins and others who are doing good work in collaboration with the government and collaboration with community-based organizations. There's a whole lot that our corporate citizens can be doing to spread the word, to encourage their employees, to provide support to the communities that they serve. And so I want to close just by saying thank you, Mr. Chairman, for this opportunity, and I am available for questions.
Thank you so much, Reverend Little. Really appreciate you and this panel. I think most of us, most if not all of us, have learned a little something from each of you. I do want to just quickly point out and flag for you and those listening that the speaker has a Black agenda, and included within that Black agenda is health equity legislation. And we are, really pushing in the Health and Government Operations Committee, the House Health and Government Operations Committee, to move that legislation and move it with real money from the rainy day fund that hopefully would be immediately available. I also want to flag for you, and you heard from her briefly earlier, the vice chair of the House Health and Government Operations Committee, who is leading on a number of legislative efforts, including legislation having to do with racism as a public health issue. So just wanted to flag those two things real quick for those listening. The hour is getting late. We do have time for a couple of questions, if there are any. I do want to make sure everyone knows that we are following up from this. So stay tuned. We will be following up with the executive branch and the governor from everything that all the points that were made and recommendations that were made. We will be following up with the governor about from this joint meeting. It won't end here, and it won't end until everybody is vaccinated, and until we we right the ship with respect to health equity in particular. So with that said, time for a question or two, if there are any. And I'm not a host, so I can't see I can't see raised hands. I'm looking at the chat. All right, I'm not seeing any questions. I don't think there are any. Thank you for, I want to say thank you to the two Crystals, our staff directors for the Baltimore City delegation, and from the Prince George's House delegations. Thank you to our panelists. I want to thank the speaker and our city and county leaders and health experts for taking the time this evening to join us. We're in the middle of a session. There's nothing more important than this subject, and that's why we joined together. We are hand in hand. We are together in this. We will be pushing. If there's any follow-up, please do not hesitate to contact myself or Chair Stephanie Smith. Our doors, so to speak, are open, even though we're in this pandemic. We are available by phone, Zoom, email, etc. So, with that, let's get on it, and we're adjourned. Thank you.